Hello friends, in the 9th week of our 12-week certificate course, we are going to talk chronic diseases management in palliative care. Because most of these patients who are in the palliative care service, they are the elderly people and suffering with some of the chronic diseases. The symptoms of chronic diseases and symptoms of aging both are manifested simultaneously in that patient. So how you will manage these patients is very tricky and very important to know. So we are going to talk about this. In this week, we will focus in managing the chronic diseases through an integrative approach by combining Ayush and allopathy. Overview of this week is stress and burnout, part 2. This is another important part. Skin care in chronic wound and bed sores, and palliative care in heart failure. The methods of elderly patient with heart failure. We will also discuss of overview interaction method for evaluating an elderly patient and heart failure for palliative care. This was the topic, and under this topic, we are going to talk psychological challenges in patient and the caregiver. What are the challenges? Early symptoms of stress and burnout. The table will be taught to you so that you can diagnose the early symptoms of burnout. Burnout is the result of persistent anxiety and stress. If persistence of anxiety, stress, and depression is there, the patient or the patient family ends up to the burnout, which is difficult to manage. So it is better to manage in the early stage when burnout has not started. So this diagnosis is very important. We are going to talk about that. The skin and wound care. Basically, we are focusing the chronic wound and bed sores in immobilized patients. That is the one part we are going to talk. And use of Ayurveda and modern techniques for healing and for infection prevention. This is the focus. And emphasizing the personalized and gentle care of the patient. And heart failure palliative care is another important part where we are going to shift from curative to comfort care in patients of heart failure. Symptom management like dyspnea, fatigue, and anxiety will be dealt upon. And use of both allopathic medicines and holistic therapy of Ayurveda we will discuss in context of heart failure quality of life. So now I am going to discuss the interaction method for evaluating an elderly patient with heart failure for palliative care. The objective of this class is to assess and interact compassionately and effectively with the elderly patient suffering from heart failure for palliative care planning. As a patient caregiver, palliative caregiver, your responsibility is to assess the patient condition, mental and physical both, and then you have to decide what kind of palliative care has to be given to him. To teach what I have, to show you what I have taught in the previous lecture. I have tried to make it so that you can understand it in a better way and you can apply it when you are going to do your assignment, which has been given in a previous slide. More specifically, there will be 5 lectures in this week 9. First lecture is stress and burnout, part 2. And these are the skin care in chronic wound and bed sores like that, palliative care in heart failure, the methods of elderly patient with heart failure. We will also discuss of overview interaction method for evaluating an elderly patient and heart failure for palliative care. These are the headings which will be talked about. So let us begin this 9th week of teaching and learning. Thank you very much.